Well, the first new guidelines for Alzheimer's disease since 1980, since the 80s, are out this morning. Doctors now tell us that Alzheimer's may affect the brain for years before we see any symptoms. Alzheimer's affects almost 5.5 million Americans, and that number expected to triple by the year 2050 to as many as 16 million. Medical correspondent Dr. Jennifer Ashton is here to tell us what these new guidelines do mean. Good morning, Doctor.
Good morning, Chris.
This is an extremely important study.
Right, and we've been expecting this to come from the Alzheimer's Association and the neurologic community for several years, because the thinking now is that Alzheimer's disease really represents a progressive disorder that really exists on a continuum or a spectrum of time where people can have disease way before it's actually apparent. So basically the new guidelines involve 3 stages, one called preclinical stage, which can occur up to 10 years before someone actually starts to show signs, and I'll tell you more about that stage in a minute. Mild cognitive impairment, where someone is still functional but they're starting to show some signs of Alzheimer's disease, and then full-blown dementia. And that's really, you know, the period and stage in this disease where people are so impaired in their daily life.
Obviously, this is a disease that worsens over time.
Right.
Early diagnosis is imperative here. What is being done in order to I guess, just augment the doctor's ability to detect this early?
Well, the bulk of the research, Chris, in Alzheimer's disease is really centering on that preclinical phase. Now, this is not ready for prime time yet, so people can't go out and just go to their doctor and ask for these tests. But those patients who are involved in clinical trials they're looking at something called biomarkers, which are proteins that are found in the spinal fluid of patients. They're also trying to correlate that with brain scans or imaging studies and see how those two things can predict whether a patient will then go into the second stage, mild cognitive impairment. Think of it very much like heart disease. Test your cholesterol, test for diabetes before you have the heart attack.
Okay, while we wait to learn more about these biomarkers, what do we know about people who are at high risk for Alzheimer's?
Well, the 2 biggest things, age and family history. As we get older, the risk increases. Over the age of 65, the risk actually doubles every 5 years. By the age of 85, and we know our population is living longer and longer, your risk is up considerably. So that's a big thing. Actually, family history, especially if you have a first-degree relative, a parent, a sibling, a child with Alzheimer's disease, your risk is greater.
Well, how can you lower your risk? Are there certain ways, any things that you can do?
3 basic things, Chris, and these are really common sense. Number 1, healthy body weight. We know that people who are obese tend to be at higher risk. What's good for your heart is good for your head, so lifestyle changes. And then protect your brain. We know that there is an association between a history of head trauma and Alzheimer's disease, so you want to try to reduce that as much as possible.
All right, Dr. Jen Ash, it's hard to believe that this is the first comprehensive study in nearly 3 decades.
New guidelines.
New guidelines.
So we're going to be
Incredible.
seeing so much more about this in the future.
Incredible, Doc. Thank you very much.
You bet.